In case of any emergency situation, always call 911 first. In the case of severe bleeding, you will likely need to step in before help arrives, and here are the steps that you need to follow. First, assess the scene. Make sure it's safe for you to step in and help. And once you know that it's safe for you to approach this patient, you'll want to go to the person and attempt to find the source of bleeding. Look for blood that's flowing fast, soaking through clothes, or even pooling on the ground. Once you find the source of bleeding, please act quickly. If you have access to clean gauze, that's awesome. If not, use a cloth or a clean shirt and press directly on the wound. Use firm, steady pressure and don't stop. If the wound is on an arm or a leg, you may need to press with both hands and use your entire body weight. Don't lift the cloth to check the wound. Just keep applying firm and steady pressure. If the blood soaks through, place more gauze on top or a cloth on top and keep that pressure going. If the bleeding isn't slowing down or the wound is deep and wide, you may require another cloth or more gauze, but please just continue to press down firmly and maintain pressure. If the bleeding still isn't stopping and the wound is on an arm or a leg, then a tourniquet might help. If you have a commercial tourniquet, like the one in a first aid kit, place it 5 to 10 centimeters above the wound. This helps pressure on the artery feeding the wound and not directly on the damaged tissue. Avoid putting it over a joint like a knee or an elbow because joints can prevent the tourniquet from tightening properly and from doing its job. Tighten the tourniquet until bleeding completely stops and leave it on until emergency services arrive. If you don't have a tourniquet and the bleeding is life-threatening, you could try to make one using a strong, wide strip of cloth or a belt, something that won't stretch and isn't too thin, but it needs to be tight enough to stop the bleeding completely. If you're unsure or if you don't have a tourniquet, then your best move is to keep applying firm and steady pressure right on the wound, because that alone can save a life. Now, if the person has a penetrating injury, for example, there's something stuck in the wound like a knife or a piece of glass, don't remove it. Taking it out can make the bleeding worse and it can damage surrounding structures. But please let the 911 operator know that there is a penetrating injury.